So I got my Snoop on a stoop. He's looking like he needs CPR to me. He's looking a little gray. Look at that. What kind of coloring is this, Amazon? For real. So Amber, your son was offered Suboxone or Methadone to help with addiction, and you want some input on it. I'm going to be completely honest with you. When I started this page in 2020, I was not supportive of medicaid-assisted treatment. I fully support the use of medicaid-assisted treatment for opioid use disorder now, and the studies even back it up. If my daughter wanted to go on Suboxone, I would encourage her and support her being on that. And when she was ready to wean off of Suboxone, I would encourage her to do Sublocade to wean off. However, people can go on Sublocade not to come off of Suboxone, but as a replacement, because you're not having to dose daily and it keeps you level without, the highs and lows that come with taking a dose. Because if you miss a dose, you'll start to withdraw. When you get Sublocade, which is the injectable version of buprenorphine, which is what is in Suboxone, you don't get those highs and lows. It's level. There is such a thing called intervention stigma. And when I say intervention, that means medications. There's stigma surrounded by these medications. And I'm going to tell you why it is. One, it's because the treatment system has been utilizing an abstinence-based model since like the 1930s, okay? And that would be the 12-step model. And this video is not to down 12 steps by any means, because I know it has helped many people. So you have people who work in the industry that's all they support, that's all they know is abstinence. Maybe that's how they got sober and they maintained sobriety. Drugs 20 years ago are very different than the fentanyl epidemic that's happening right now and killing, more people than ever from overdose. And a lot of the intervention stigma surrounding Suboxone, Methadone, it's a lack of knowledge. Now add the stigma just of addiction and substance use disorder to that. Because society as a whole has dehumanized people who suffer from addiction, they just look down on any intervention possible. So the people who tend to relapse in these abstinence-based programs, they'll ride that pink cloud and they'll put themselves all in. But what this medication can do is it can keep those cravings at bay and keep them being normal functioning members of society, as they say. I've had the opportunity to work with many, and some of the best nurses who are on Suboxone. You would never know it. They have their lives back. They were able to maintain their license. They were simply victims of trauma, and they turned to self-medicate. I wish more nurses would speak out openly about their struggles, because I think that could end a lot of stigma, because a lot of people don't realize how many medical providers are in fact on Suboxone and working and caring for patients and doing a great job doing so. Trust me, they do.